Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning in to my latest video. So for a patient who attended with bilateral occluding earwax, so the term bilateral in reference to ears means both ears. Occluding is when the ear canal is completely blocked and there's an airtight seal. So if it was semi-occluding, it would mean half the ear canal is blocked and we can see most likely half the eardrum. We're commencing in the patient's left ear, we're near the entrance, we know that because we've got the cilia there. So these hair strands are located on the outer third of the ear canal only. The inner 2/3, so what we call the bony part of the ear canal, they don't harbour any hair follicles, so there shouldn't be any hairs at least growing from the bony part of the ear canal. This earwax also contains a high concentration of dead skin, what we call keratin. The majority of earwax is actually composed of dead skin, approximately 60%, and the remaining 40% of earwax is a combination of a sebum, which is an oily, fatty secretion, the same secretion that occurs on our scalp, and also a modified sweat. It's an oily sweat secreted by the alpocrine glands, are the same glands that we find under our armpits. So this oily sweat and this fatty oily secretion sebum combined with dead skin, it amalgamates and it forms earwax. It is quite stubborn, so I've just put some olive oil spray in there just to lubricate the wax plug, so it kind of helps it to mobilise it off the canal wall. It also helps to lubricate the inside of the suction probes. Quite often wax can travel up the suction probe and get blocked, and you can see these little wriggle motions I'm making, so that just helps detach the wax off the canal wall. So I've just got a segment out there, and judging by the colour of this wax, we know the earwax has been in there for a while. Freshly secreted earwax is more of a light brown, almost an orange colour, and the longer it's in the ear, it oxidizes and it turns darker, and eventually can almost turn pitch black. I've managed to wriggle this plug out. You can see it's really dry. It's got a few matted hairs there, quite a long piece. Patient's got a nice healthy eardrum. There's just a fleck of dry skin there. Just decided, because the patient was really still, just attached a fine end suction probe and I just hovered over it just to remove it. The patient's got a good light reflex, nice healthy ear canal, made a big improvement to the patient's symptoms that they arrived with. So some of the symptoms the patient attended with was tinnitus, which is any noise that originates within inside the ear or the head and it's not an external stimuli. The patient also had a bit of vertigo, so occasionally positional vertigo and they turn their head. Now that may not be due to the wax, but it can sometimes be. And of course their hearing wasn't great. We're now onto the patient's right ear. I immediately put some olive oil spray in there just to lubricate this because it's quite dry. And sometimes when it's dry you don't get a suction grip. So just by putting a bit of oil on there, it softens the surface, which then enables me to obtain a suction grip. Again, we're near the entrance, you can tell there, a few hair strands. Not much we can do about those. We don't want to trim these just for the sake of removing wax. These hairs serve a function as well. They help filtrate the air. Earwax is actually good for you, and it's these hair strands that, at the follicles, at the root of the hairs, that's where the sebaceous glands that's secreting that fatty, oily substance, and the sweat glands, they're attached to the follicle of these hairs deep in the ear canal. So by cutting that, we're going to stop the natural secretion of these oils, which are beneficial for the ear. Sometimes though, if it's really, really plugged, full of hair, we can't visualise the eardrum, we do have to pluck them. Also, these hairs, they can help the natural migration of skin out of the ear, which then in turn brings out the wax. So the direction of these hair strands, the angulation, and which way they're pointing, it's rumoured to help the migration of skin and wax, but of course if there's too much, the wax can mat against it. So it just mopped up a bit of dry skin off the posterior canal wall. That last plug was quite medial. Got some soft sticky wax just on the cartilaginous portion on the right. Again, lovely healthy eardrum. It's just a quick video of all the plugs. You can see just how dark they are. I've just gone through the comment section from my last video, so some of the questions that jumped out to me. I think someone asked some tips of itchy ears. So with itchy ears, it's very important you keep your ears dry, avoid water. So if you're going swimming or even when bathing or showering, try and get some earplugs, some swim molds. You can get these over the counter, some foam ones or some silicone ones that you just pinch, insert into your ear and they expand. You can get custom swim molds. Ear calm, which is what we call in the UK ear calm, at least I'm not sure what it's called around the world, but it's just an acetic acid. The natural pH of the ear should be slightly acidic. Sometimes when people get itchy ears, it's what we call otitis externa. The pH changes from an acidic pH to an alkaline. So ear calm, acetic acid re-acidifies the ear. I'm aware that some Olympic swimmers apparently every time they go, although they do wear protection for the ears, but inevitably some water can get in, they use ear calm, which contains acetic acid, as I mentioned, on a regular basis just to re-acidify the ear, because the water entering the ear can wash away some of the natural acidity. Don't poke in your ears with a cotton bud or anything else, because by doing so, you're damaging the epithelial layer of skin. So that's the skin that lines the ear canal. And once you've damaged those skin cells, when those skin cells eventually regenerate and heal and grow, that process of regeneration and healing it will cause an itch. So by scratching your ear today, you're almost guaranteeing an itch in a couple of weeks or a month's time. Of course, if your symptoms are much more severe, you need to visit your doctor, have your ears examined, sometimes some allergy tests, blood tests, to see if you've got, as I said, some allergy going on. I'm aware that menopause or premenopause can also cause dry, itchy skin. I believe another question was whether children who suffer from earache or ear infections, I think it's more specifically sensitivity to wind, can their condition improve as they age? Yes, don't see a reason why not. Many children are prone to developing glue ear due to a blocked eustachian tube, because children, of course, are more prone to getting little sniffles, being around other children at school. Also, their eustachian tube is a lot narrower than adults, and the position, the angle, the plane of the eustachian tube is more horizontal as opposed to vertical, which is the case in adults. Therefore, in adults, because of the position of the eustachian tube is more vertical, gravity helps drain any fluid out of the middle ear through the eustachian tube. Another question was whether this is a new tool yesterday. No, I've used the Henkel forceps before. It's very seldom that I do, but it is up my armoury if needed. I think I had a criticism as well about not using an ear hook, and the ear hook was the best instrument for that procedure. If you do watch that video back, you can see that I did use the ear hook on several occasions and it wasn't the right tool. Well, I wouldn't say it wasn't the right tool, it wasn't the most appropriate tool in the end. It helped me remove that plug of skin, the keratosis obturans, off the canal wall before I can extract it. So it wasn't the best tool, but it was the tool that I needed to use. Another question was whether that expansion of the ear canal is permanent. Typically, yes. Once you've had keratosis obturans, that expansion it creates in the ear canal can be permanent. Sometimes I suspect, that bone can regenerate because you get a condition called exostosis or surface ear, where the bone you get bony spurs. So the bone has got the ability to form spurs. So maybe where it's expanded, it can almost self-heal. But in my experience, once you've had that expansion, typically it's there. Another question was, what's the difference between keratosis obturans and a canal cholesteatoma? A canal cholesteatoma is when you've got this skin and it's then embeds itself into the ear canal and it starts chewing away at the bone, and it's almost a flesh-eating infection, and it can go down to the jaw, it can affect the facial nerve, it can spread upwards up the temporal bone, towards to the brain, so it's very, very serious. That's more of an infection due to dead skin. They are very rare, but I've had a couple. Whereas keratosis obturans is more of a skin plug. It's not infectious typically, and it just needs removal. But I hope you enjoyed that, guys. Take care. I'll speak to you soon.